Inflation's at a 4-decade high, but healthcare costs haven't risen at a similar rate yet. Why is that? We've got the man with the answer, Paul Seegert, managing partner at PCS Advisors on the KRLD Newsline. And Paul, first off, especially because of inflation, are our premiums going to go up this year?
It depends how you're getting your health insurance. If you're getting it through your employer, the answer is yes. And I'll explain why. If you're getting it through a government subsidized program, then you'll be insulated from it because we expanded subsidies with the Inflation Reduction Act through 2025. So a lot of those folks will be insulated from it. It doesn't mean the costs aren't going up through this in the system. We looked at 72 markets, and actually Kaiser Family Foundation did a good analysis of it. And these Affordable Care Act exchanges, the rates are going up 10%, which is more than normal, certainly. So that's happening, but people that are getting their insurance through those sources won't notice. If you're in an employer plan, that's the group that's going to get the hardest hit. It's delayed. Healthcare inflation runs 2 to 2.5 times CPI, which is a scary thing to say right now. But it comes with a pretty big delay because insurers go out and get multi-year agreements with hospital systems and provider groups, and they set the reimbursements and they're static for, multi-year periods. A lot of those are getting renegotiated right now. You can be sure hospital groups, provider groups, they're going to come to that negotiating table aggressively because they have watched their costs go up like everyone else, labor costs, cost of materials, cost of goods, and their revenues have stayed the same.
Is there anything that we can do to insulate ourselves at all from this, even a little bit?
Well, there are employers that are performing better than others. I mean, there is a bright spot out there. If your employer is working with a consultant who can help them build a plan and not just buying it at retail, then they oftentimes can get better results. Now, there's so much waste in the way that we pay for health care. Lots of employers are getting to a breaking point where they're digging in and eliminating that waste, and the waste exceeds the coming increase. It can be dealt with, and that's happening kind of one employer at a time. And as you would expect, larger employers are leading this charge, and it's kind of trickling down. So that's the solution, but unfortunately, it's a slow process. It's something we need to address at a national level and state by state as well, because our whole system relies on employer plans to prop up the system. When you hear the word subsidy, you probably think I'm going to start talking about the government. Sometimes I am. But when it comes to how we pay for health care in this country, RAND just did a study that confirmed yet again employer plans are paying much more than other payers when their people go to a hospital, 224% more. And when you take that into account, and then you look at the fact that enrollment in employer plans has been declining over time. Today, only 49% of us get our health care at work. And the same dynamic is going on. So you have this dwindling supply of employer payers who are paying more to offset the fact that when someone with Medicare or Medicaid shows up at that hospital loses money on that transaction. This long-term trend is not sustainable, and I hope soon we'll do something about it.
That's Paul Seegert. He's the managing partner of PCS Advisors. Really important topic there.